back. This is the Now Morning Show, and I want to say special shout out to our frontline workers who, have been working assiduously over the past few months since March, actually. And when it first started, everyone was giving all these applause and all of that, but we still have to keep it going. It's Christmas time, which means that many of them won't be able to spend Christmas with their families.
And yesterday, Lisa, I saw that we hit 7,000 positive COVID cases in Trinidad and Tobago.
I was like, when did that happen?
Right?
Yeah.
Over the last, it's been a few months, huh?
Yes.
It's been a few months.
But if you don't check for a few weeks and then you come back, you're like, oh, what happened there?
Yep.
And we also, just chatting with Dr. Robertson, who said he's just one of 2 trainees abroad. And there's so many, but also those who are here in our hospitals at the NWRHA and all the various RHAs across the country, including Tobago. We want to celebrate you this morning, this entire week, because this week, many of you will not get to be with your families because you're taking care of others and making sure that they are safe and sound. Now, over the weekend, news came out that there's a new strain of coronavirus that sent the UK back into Tier 4 lockdown. That's Christmas week, guys, and they're right back to where we started a few months ago. I'm chatting with Dr. Erica Wheeler, WHO and PAHO representative for Trinidad and Tobago and the Dutch Kingdom Islands about it. Good morning, Dr. Wheeler.
Good morning, Lisa. How are you today?
I am, it's Christmas week. We want to keep the spirits up, so I'm doing really well.
Good.
Notwithstanding, we know what's going on. We're in the middle of a pandemic, and I'm seeing where the UK has gone all the way back to Tier 4, and it's about a new strain of the virus that's 70%, it's spreading 70% faster than the one that we know. What can you tell us about this?
Okay. Well, all viruses mutate, and the evidence is from WHO that there have been many variations or many strains of this virus to date. So that's not unusual. We don't happen to hear about all of them.
Right.
But of course, the reason why we heard from the UK, it's because it seems to be transmitting more quickly.
Yeah.
However, this does not necessarily translate into the fact that the virus has become more virulent, more dangerous, not because it is spreading faster. It means it will cause more death or sickness. But we don't know yet. The UK has shared the information and the genomic sequencing with WHO. But you have to remember again, and we have to keep reminding ourselves that this is a new virus. So it will take some time to actually discover whether it is in fact any more infectious, but there is no data to date to say so. Apparently, it has been circulating since September, but it's only recently we have the number of 1,108 persons in the southwest of England who have tested positive for this variant, and they have noticed this increase in transmission.
So they've gone right back to Tier 4 lockdown. Because of this, which means everyone back indoors for Christmas week. Do you anticipate a ripple effect throughout Europe and then coming back to the West on this side?
Well, of course, we see countries have already started talking about closing their borders. So it is inevitable. It's because it's a new virus and persons are concerned. But remember, transmissibility is not only about the fact that the virus may have changed a little bit, it's also our behavior.
Right.
All the public health measures, if they are not observed, of course, the virus will continue to spread. This is how it lives. This is how it spreads through our behavior, whether, if we don't wash our hands, if we don't sanitize, if we don't keep our distance, if we don't wear a mask. So it's actually a combination of the two things. And it is only research, population-based research, that would show us how much is attributable to the actual change in the virus and how much is attributable to our own behavior. So that's why we have to continue the public health measures. But naturally, if it is spreading more quickly, then this is something, of course, that countries will be concerned about, but it is not the only variant of the virus around.
Yeah, the measures that are in place, physical distancing, hand sanitizing, washing, wearing a mask. It's Christmas time, and I think from what we've been seeing, and we're not encouraging, persons tend to be a little more complacent at this time. The alcohol kicks in. Do you anticipate that we would see an uptick in January, causing us to probably relook our own situation?
If persons do not observe the public health measures, it is inevitable that we will have a spike. as I just said, it is not just the virus, it is us. We are the hosts of the virus, and we can have some control over how quickly it spreads amongst us.
Yeah.
If we observe the public health measures, then that would slow it down. If there are gatherings over Christmas that go above what we have been told to observe, we can expect to see an increase in cases. But we're hoping by now, after having endured this for almost a year, that we've become more wise and socially responsible, and we would know what to do.
Yeah, well, we'll see in January. Let's switch it up a little bit, Dr. Wheeler. I saw over the weekend that Cuba has been flying under the radar, the first country in Latin America. No surprise there for me, but certainly it's been under the radar, developing a vaccine. What do you know about this?
Yes, that is the case. But okay, so let's go back to how a vaccine is actually developed. There needs to be clinical trials. There are three phases. The most preliminary one, starting from phase one, going all the way up to phase three. By the time you reach phase three, you have to have at least 30,000 volunteers, and preferably from countries where there is community spread. So yes, Cuba is developing a vaccine, but it has not reached clinical stage three of the phase three of the clinical trials.
Ah, okay.
And of course, PAHO is a non-political organization. So if that time comes and the vaccine that Cuba is producing has been proved to be safe, of good quality, and stops the disease through the clinical trials, then of course they will be included in the COVAX facility, because UNICEF and the PAHO Revolving Fund are the two agencies responsible in our part of the world for procurement of vaccines. And naturally, they will be included as long as they meet all of the other requirements, but they still have some way to go.
So rumors of this vaccine out of Cuba being suppressed, and sanctions on countries that use the vaccine or receive the vaccine from Cuba, from where you sit, those are just rumors, correct?
Yes, correct. The facts and the science of it is they need to reach the phase three of their clinical trials and prove all of the things, just like the other vaccines: quality, efficacy, and safety, and then they will be included.
All right, that's a positive note to end there right now, Dr. Wheeler. Thank you so much, as usual, for jumping in and sharing the information, clearing things up for us. That was Dr. Erica Wheeler, a country representative for Trinidad and Tobago and the Dutch Kingdom Islands for the WHO and PAHO.